I had my first Mercier Therapy appointment with my friend Kelsey. She does it here locally in Utah, or in Utah County. And wow, I'm sore. It was definitely intense. She gave me lots of supplements, which I'll talk about in a later video. But yeah, that was not, it wasn't as painful. I got to go to one of her sessions when she was doing it, and it wasn't as painful as what she was explaining to me how she was. But it was kind of intense. So I had my second Mercier Therapy appointment with my friend Kelsey, and it went good. We'll see how I feel later today. I was quite sore, like for 3 or 4 days after. It kind of like was tender in my pelvis, where like my uterus and ovaries are. But I'm feeling better, and it, yeah. So she has me on some supplements. I will ask questions next time, and yeah, it should be good. So I just finished my third session with Kelsey, and overall it seems to be doing good. She was more intense this time than before, and we did discover last time we noticed this, but my left side is a lot harder to, it's so weird trying to describe this because it's like a muscle thing, but it was harder to push down than the left side or the right side. This happened last time and we noticed it this time, but she did. I've been doing some recommendations that she had suggested, and so because I've been doing that, it was a lot easier for her to massage. So yeah. But yeah, that's really what I was a little bit sore the very first time, but last week I wasn't sore and would probably not be sore again. So yeah, it's been going good. Today was my fourth session with Mercier Therapy with Kelsey, and it went really good. It wasn't really crampy. She didn't want me to do it on my period because of possible endometriosis, and so that like doing massage on the uterus could most likely cause more bleeding and actually do more harm. So we waited. So it's been a little over a week since I went the last time, but so far so good. Like I've said in previous times, it's good over the long haul. So what we're doing now will ultimately help later down the road. So doing good. We'll see how it goes. So I just got done with my fifth appointment. It went good. Nothing new on the front of my ovaries and pelvis. I did ask her about my pelvis, or my uterus. I asked her what she felt like it was shaped like, and she felt like it was retroverted. So it was pulling back more towards my colon, because she said she has to go deep in order to get a deeper massage. So, and I kind of knew that already, because when they went in and did embryo transfer with our embryos in 2016, they noticed that my uterus was not in the right place. So I don't know if I'm thinking that that's a cause of endometriosis, has something to do with that. Mine is obviously not as severe as other people's. But anyways, it's good to learn more about my body And we'll see how my periods change. The last couple of months, they've been not as long. They've been 2 days shorter than normal. So I don't know if that's going to that's going to be a trend. That would be nice if it was shorter. But my cycles aren't any, like, the length of my cycle is between 24 and 26 days, typically anyways. But we'll see what this does as far as, like, ovulation goes. Next time I'm going to ask some questions with her, just to kind of explain what Mercier Therapy is, and how the benefits of it. So yeah, we'll see how I feel. I felt good last time. It's been a little bit over a week since I went with my last appointment because we were gone last week. So I didn't have an appointment last week, so it was almost a week and a half ago. So it felt good. It was a good pain, but it was good. I like those kinds of massages where it's painful, but I know I only have to endure it for a little bit of time, and I will benefit and feel better afterwards. So a couple of questions for you. What exactly is Mercier Therapy?
So Mercier Therapy is a visceral manipulation technique created by Dr. Jennifer Mercier. So essentially it's a deep massage of the reproductive organs meant to correct malalignments, adhesions, restore blood flow, that kind of thing.
Cool. What are the benefits of doing Mercier Therapy?
Benefits include restored blood flow, which helps to optimize the function of the reproductive organs, breaking up any adhesions that might exist from prior pregnancies and births, miscarriages, surgeries, any sort of trauma in this area. So we're trying to break up those adhesions and scar tissue and create better mobility and better natural function.
Cool. And then what's the science behind it, if there is any science behind it?
Yeah, so basically, think about what you would do if you had an injury in any other part of your body. If there was scar tissue or restricted mobility, you would rehab it, you would massage it, you would stretch it, you would try to restore proper functioning to that part of your body. We're essentially doing the same thing with your reproductive organs, restoring that blood flow and helping mobility and creating a better function.
Awesome. Cool.
Yeah.
Thanks.
Mm-hmm.
Well, I just had my last appointment with Kelsey. I should have had it last week, but because of how my period started, and so it kind of got all messed up, and the best time to do it would have been over the weekend, and she's not in her office over the weekend, so I had to rearrange some schedules, so I was a little bit later than what I should have done, but one thing that I did want to mention was the whole reason I liked what she said, with the reason that you would do Mercier Therapy as opposed to not doing it at all, and like you would for any injury, or at least for me, that's what I would do. I go to my chiropractor, I go get a massage, I work on the muscles. Like, so you get into a car accident and you go to the chiropractor, you go to a physical therapist. It's kind of the same thing for this, is just kind of loosen everything up and make sure that everything is aligned and where it needs to be and functioning properly. That's the big key. You gotta get it to function properly. So I did ask some questions about, because I believe I have endometriosis. It's probably not as severe as a lot of people. So I asked about that and what I should do. And she said if I feel like I'm getting more pain during my periods, then I should probably schedule a follow-up with her. And it wouldn't hurt to do it. She said someone with endometriosis to do it every other month or even every month to make sure that we're just kind of clearing that endo out and we're like staying healthy and staying flowing and having everything working properly. And then also like scar tissue buildup, because I know with endometriosis a lot of people go and get laparoscopic surgery and they get all that endo removed, and with that causes scar tissue. So this can really help break that down. She did also mention after birth you would want to, there's like all that buildup from having a baby and from if you had a C-section. So there's all that scar tissue, like I said before, all that scar tissue buildup. So that really will help with that. So I think it's good. I'm probably going to do some follow-ups later down the road. So hopefully this will be a good thing for us in our journey to try and get pregnant again on our own. So